Hey, hello everyone. Welcome back to Level Up Mental Health. My name is Swizz. We got a great topic here as we review the skill checking the facts in opposite action. Now, in the previous video, we kind of touched base a little bit about what this was, especially when we're talking about radical acceptance. But here we'll be able to learn what it means to check the facts and what it means to utilize opposite action, especially when we're dealing with situations that where we experience we kind of run into those cognitive distortions, right? The fact of whether it's the black and white thinking or the difficulties of just kind of seeing the clarity of our thoughts, right? And here's a few skills that we're going to try to practice. And again, I'd seen this the other day about a good way to kind of view these skills here and being able to kind of view what therapy is and how to reduce those intensity and frequency of those symptoms. The goal of with therapy and mental health treatment is to be able to really just kind of strengthen this muscle per se. Think of this as more so not like a doctor's visit where you often go there and the problem solved kind of, whatever it is. You find kind of medication, boom, you're all set, right? This is more like going to the gym, right? And the more they're able to kind of practice and strengthen it, the stronger it gets and the easier it becomes to challenge it, right? And it really is, it's a great kind of comparison because, again, it takes time, it takes effort to be able to do that. And a lot of times people may think, oh, I've done everything I can and I just need medication, right? And medication is helpful, right? It's important that for those that are taking it, especially there's a biochemical imbalance that needs to be addressed for sure. That's really important. But a lot of oftentimes is people may view it as kind of a miracle pill in that sense. Like, oh, let's take the medication, I'm going to feel better. What's important to understand is that at the end of the day, those stressors are still going to be there, right? The things that may cause you the anxiety or the depression, that's still going to be there. And if you don't have the right tools to be able to handle it, it's going to continue to be there. It's going to continue to impact you, right? So that's where skills like this one that I'm about to show here about checking the facts and ops action, this is where these really come into play. Okay? So let's take a look at our little worksheet here. And we're, of course, greeted with the wonderful DBT scale of emotional intensity. Now, again, I'm probably going to do a separate video on this here soon. But the goal of the DBT scale of emotional intensity is essentially to rate your emotion on a scale from 1 to 10, 1 being the lowest, 10 being the highest, where you are currently. And from there, it allows you to kind of dictate which area you need to go to utilize which skills, right? So if you're in that red zone, that 7 to 10 range, you're viewing whatever that stressor is to be a crisis, right? You need to use distress tolerance skills, things like TIP, 5, 4, 3, 2, 1, removing yourself from the area and kind of utilize the ability to distract yourself so you don't get really embedded with that crisis. If you're in that 6 to 1 range, this is where your ability to regulate your emotions comes into play, kind of your self-reflection, things like journaling or completing worksheets is really important. And as we get through these two skills here, checking the facts and opposite action, this is what the area that we want to focus on. So for an example, we're not in a crisis, we're not experiencing a panic attack, we're more so maybe having kind of a little bit of elation in our elevation in our mood here, and that's where these skills come into play. So the whole goal, again, for emotional regulation is be able to understand it, decrease the frequency, the emotional vulnerability, and decrease emotional suffering. So that's what we're trying to do here. Checking the facts. So what essentially does this mean? Well, in general, it's being able to just kind of recognize what's in front of you, right? Does your emotions fit the facts, right? Am I experiencing something that is a catastrophe, right? Is there a threat that I'm going on? Does the emotion that I'm feeling right now fit how the facts of the situation are, right? So, and again, when you look at that sense, there's kind of a nice little flow chart here where you can ask that self, does the emotion fit the facts? So if you're feeling, angry because you got punched in the face, yes, that's an emotion that fits the facts. Of course you would feel that way. If you're feeling angry because you saw, maybe something, a comment that was said elsewhere in that sense, right? And you feel is directed towards you. Does that fit the facts? It may not, right? Because it may not have been directly at you. You may be angry at it. It may feel like it's being internalized, but we don't know if that's what happened. And that's where we're questioning, does the emotion fit the facts? So it's being able to act on the emotion, obviously be mindful, act on emotion, and problem solve. If we feel that it's not important or if it's not appropriate to act on the emotion, we want to consider opposite action, which we'll get there in a second. So the same thing relates to this. Does the emotion fit the facts? Is it acting on emotion effective? Yes. Then again, we don't want to act on those urges. Compared to the other side where if it does not, then we want to be mindful, right? So through the facts, as we are understanding it, they're set off through the events that's going that leads us to have the thoughts, the emotions, and behaviors, right? So that's why, as you can see, cognitive behavioral therapy really comes into play here, right? So being able to examine the thoughts and checking the facts can help us manage our emotions. So how do we do that? First, ask yourself, what is the emotion you want to change? Then ask, what is the event prompting my emotion? Being able to describe the facts and challenge the judgments is the key here. The more you're able to provide kind of the description that associated with that event, the more evidence you have to understand of does the emotion fit the facts here. Third, what are your interpretations, the thoughts, and assumptions about the event? Be able to challenge that initial interpretation that you have. Again, as we said in the previous videos, it can be very hard because we've had these conditioned thoughts for a while. It kind of, as I said in previous videos, I'm really into kind of the behavioral kind of philosophies of certain things and how you were brought up and how you were raised, really kind of establish your preconceived notions about certain things of life. So it can be really hard to break that, to change that interpretation, to view it. But that's what we're trying to do. We're trying to challenge it in a way to view of a different interpretation of the situation. Fourth one here, am I assuming a threat? Again, be able to label it, assess the probability, and go from there. Define, is it a catastrophe? And how do you define your catastrophes? And the last one here, does the emotion intensity fit the actual facts of the situation? So, certain emotions that fit the facts: fear, there's a threat to your life; anger, an important goal is blocked or desire interrupted. These are just some examples. I'm not going to go through them all. Kind of another one here, sadness, you lost something or someone permanently, right? So you kind of review this. You can pause the video, take a look. That's essentially what we're trying to do there. We're trying to see, do these emotions fit the facts? Now, what's important is that there is this other category here, right? And I think what's important is that obviously there's going to be individualistic particular events that we may identify with. And if you can find those out, the better you'll be at being able to handle it. Now, we're going to move on to opposite action here, because again, the whole goal is if we feel that if we act on that emotion and it may lead to kind of a disruption there, the goal is to provide that opposite action, right? We want to use it when the emotions do not fit the facts, excuse me, or when acting our emotions is not effective. So, the emotion for fear, run away, avoid; approach, don't avoid, right? For anger, we want to attack; gently avoid, be a little nice; sadness, withdraw, isolate; get active; shame, hide and avoid; tell the secret for those who will accept. That's the goal that we're trying to achieve. We're trying to do the opposite of what we're feeling there. And it's going to take time. It's going to take practice. And it's going to be very hard. But again, the more that we do it, the more we go through it, the better we will be at handling it. Okay? So, that is checking the facts in opposite action. Like I said, it's a very important skill. The meat and potatoes of it all, the nitty gritty, the kind of the sum it all up. You just want to, if you experience a particular event, you want to remind yourself, what are the facts here, right? If you say that you're a failure, how do you define what a failure is, right? What is the evidence proving that you are a failure, right? If you start to say, oh, well, Yeah, I didn't get this job, and that means no one wants me in that sense. Okay, so maybe you didn't get this job, but have you gotten jobs in the past before? Yeah, well, I have. So does that mean you're a failure if you've gotten previous jobs in the past? To me, it's indicating that your skill is showing that you can be an effective worker because your resume shows that you've had these jobs before, right? So that's the whole goal there, is being able to kind of counter in a way and challenge the current perspective that you have and remind yourself that there's others out there. And the more that we're able to do that through self-reflection, through journaling, the better we will be at being able to kind of create that kind of common response that we're looking for. You might have that thought, but then challenge it right away, and that's the ultimate goal there. Okay, so that's all we got. If you're watching on YouTube, make sure to like, subscribe, hit the notification button for future videos. Otherwise, I'm hoping to start back up Psychonauts. I know we're close to the end. I want to kind of wrap it up here. Just, again, been exhausted with work and with family stuff. So I'm hoping to knock it out this week. If not, we'll just have to postpone it to the next one. But for those that are watching, thank you so much. Have a good one.